Sudden cardiac death is as scary as it sounds. Your heart just suddenly stops for no reason. Earlier, I talked with local cardiologist Tim Malins about this in our Your Heart segment. A lot of people think that sudden cardiac death is the same as a heart attack, but they're completely different, aren't they?
Exactly. So sudden cardiac death is there's something in the heart, whether it be electrical or narrowing of the artery, which causes the heart to lose its normal electrical balance. And so most of them are what we call ventricular fibrillation.
Is there an underlying cause that leads to sudden cardiac death?
So I put it in kind of three categories. The first is what does cause a heart attack, and that's narrowing of the arteries. Two is some people have very, very weak hearts, and they can no longer pump anymore. And third are kind of genetic things that you're born with, things like prolonged QT syndrome, Brugada syndrome, and some of these athletes that you hear about, young athletes that die all of a sudden from a cardiac arrhythmia, and that's due to an abnormality of the heart muscle itself.
So I'm assuming once a doctor red flags you for any of these conditions, you're being treated long before there's a risk for sudden cardiac death.
Yes, hopefully. So these are picked up sooner than later. Children are difficult because unless they're having episodes of passing out or palpitations, you don't necessarily pick those up. In the older population that have a lot of burden for heart attacks and things like that, we do have criteria where we will protect these people with medications and things such as defibrillators.
And how many deaths occur due to sudden cardiac death in the country? I mean, when we're talking the whole global thing of heart disease, what accounts for the sudden cardiac death in terms of numbers in this country?
So numbers, the good thing is we're on the decline. We've been on the decline since 1960.
That is good news.
The last number that I saw was somewhere around 325 to 350,000 people a year.
Still so many.
A lot.
All right, one more reason why I'm assuming it pays to have a defibrillator in your workplace or in public spaces.
Absolutely.
You know.
This has contributed to that decline that we've been looking for. So it's a very, very good thing that we've been doing.
All right, Dr. Tim Malins, thank you for joining us.
Thanks, Lori.
And for more Your Heart and You segments, just head to our website, rochesterhomepage.net.